Take the time to prioritize your social health, and make connections while you're at the university, whether that's, clubs and organizations, meeting people. That's a big part of what the university experience is. There's things that you learn in the classroom, and then there's the connections you make inside and outside the classroom. And I think that's got to be part of the formula. That challenges us. We're richer because of it. We make connections and friendships because of that. And I think that's really special.
Hello everyone, welcome back to the UAZ podcast. Today we have a special guest, Mr. David. He is from the Health Campus, the Executive Director of Health Campus, and we're really so proud to have him with us to have this conversation about campus health. I'm your host for today's episode. My name is Rebecca, and I have my colleagues here with me.
My name is Nicole Camacho.
And my name is Marco Pacheco.
So we're going to start the podcast for today and kind of have a conversation on campus health. So thank you so much for being with us. This is UAZ podcast, and you don't know how much we are proud to really have you.
I'm glad to be here, actually. I was telling my daughter I'm doing a podcast today, and she was so excited. So I guess I've made it, guys. Thank you for that. I appreciate that.
That is great. So what do you really do here as the director, as the Executive Director of Campus Health?
Yeah, so I've worked at Campus Health for a long time, worn a lot of hats over the years, but I think in terms of what we do in terms of student support, a lot of that really falls on our providers, our physicians, our nurse practitioners, our counselors, psychologists, social workers, health educators, lab professionals. So they're really the ones doing the work every day. I think my job really is two things. I see myself as being somebody who really, in my role, maintaining campus health's excellence. We have a long track record of, I think, great work at Campus Health over many, many years. I think this is our 107th year, and we're really proud of that. We've been on campus for a long time, and we were started after the 1918 flu pandemic, and we're now a second pandemic and counting, and we've been a big part of it, I think, the University of Arizona for many, many years. But I think we're really proud of the fact that I think on almost any level we tend to rank and rate really highly with our students. We've been in the top 10 for Princeton Review for many years, and for best health services. So they look at like 391 colleges and universities and try to figure out what are schools doing really well. Everything from intramural sports to dining to campus. One of the things they look at is health facilities, and we're really proud to be, I think, in the top 4% for now 12 years running. So that's been great, and that's based on direct student feedback. We also do a lot of things internally. We do patient satisfaction surveys, both in fall and spring, and we have 97%, 98% of students would recommend us to a friend, so that's really good. One of the best things, really, in my role as executive director is, if I am out, just like I'm meeting you guys, I talk to people, and oftentimes people volunteer, hey, I had this great experience at Campus Health, and I talked to one of your providers, or had a great experience with a visit, and I didn't know all the services you had. So I get to hear about that stuff every day. But it's really our providers and everybody on the CAPS team, on the medical team, on the health promotion team, who are the ones kind of doing the work every day to make sure that students feel supported and get the care they need.
Before we have any guests on the podcast, we do research on the person who will be on the podcast. And I was doing my research. I was on Instagram, and I saw a reel that you were in, posted by UA Medicine, I'm pretty sure. And you were saying how important it is to be involved with the college and joining clubs, and how important, but also being focused on your health mentally and physically.
Yeah. No, thanks for that. I think, during the time that I worked at Campus Health, we've kind of gone back to the early days when people were talking about a mental health crisis, not only on college campuses, right, but across the United States. And I kind of see things a little bit differently. I think a lot of things manifest kind of on the individual level, and that's where the symptoms show up. But I think a lot of what we're seeing, not only at colleges but across the U.S. and other countries as well, is, I think challenges with our social health. I think, we're social creatures, and I think, as much as I love technology, technology is probably one of those things that is, presents some challenges in terms of making sure that people spend time together and feel connected to each other, connected in an analog way, right? So, I think, that's one of the great things that we offer at the university is so many opportunities to get connected, through your dorm, through clubs and organizations, through professional organizations. We've got a lot of students who actually come through us at Campus Health, and they're volunteers, they're student workers, they're interns, and we're really proud of that experience. So we do a lot of training with healthcare professionals. So whatever that niche is, I mean, many students find it with their faculty members, with their professors. Others find it in terms of finding social groups or interest groups that they connect with. But whatever it is, I think that's a huge part of overall health, and it's good for their health and well-being on a personal level, but it's also going to make them more successful during their time here at the U of A.
Yes, this is me and Rebecca's first semester here at the U of A, so I'm learning so much so fast. I didn't know there was health services here on campus. So what are some services here that students may not know of?
Yeah, that's a great question. So one of the hardest things that we hear, and we hear it once in a while, is when students come to us, maybe their senior year, and they're like, wow, I had no idea of all the services you offer. So we're always trying to make sure that students, when they first get here, either as a freshman or as a transfer student, they know about our services right away. So, if they don't need our services, I think that's great, right? But we also want to make them aware of what's available to them if they're not feeling well, if they're ever struggling, or if they just need some support. So that's a big part of what we do. And we do a lot of that through our health promotion team. We go out to students. We're not just waiting for students to show up at the door. We go out to dorms, we go out to classrooms, organizations. We do a lot of university events to make sure that we have a presence there. So that's really important to us. I think even students who know about our services are surprised by the scope of services. We often say that, if you've been at one campus and you've seen the health center, you've seen exactly one health service, right? Because they look very different on different campuses. Some health services are more contained and more defined, and some are more expansive. And I think ours are probably one of the more comprehensive you'll see at a big school. So we're really proud of that. In terms of the services, urgent care being a big entry point for a lot of students, we're going to be moving into cold and flu season, right? So that's oftentimes an entry point where students find us and they're not feeling well. But in addition to urgent care, we have primary care, we have women's health, sports medicine, the same providers, same doctors who are working with our student athletes are the ones who would see you if you have an injury. Obviously, our counseling and psych services department, with counselors, psychologists, psychiatry, health promotion unit, which, again, as I mentioned, goes around campus and making sure that students know about what we offer and promoting ways that they can stay healthy while they're here at the U of A. So really a lot of services, and hopefully students will have a chance to use them while they're here.
And then with those services, on average, how much do you see students actually being impacted by them, and how much they use these services on campus, and how they connect with others, and how they spread the word around?
That's a great question. I mean, we try to get this at a variety of different ways, and one of the ways, just kind of a bellwether question, if you and I go out to, whether it's a doctor's office or a restaurant or a place to take our car, would you recommend it to a friend? So we do a lot of patient satisfaction to ask about that. And we, as I mentioned, we have really high patient satisfaction rates. But we also like to get even more, I think, detailed than that in terms of the experience. So we'll ask students, does having the availability of campus health services, on the medical side, on the counseling side, does it help you stay a student at the U of A? Because that's what we're really trying to do, right? Because it can be really disruptive if students have an illness and they have to seek out services off campus, or they don't get the care that they need. So that's a big part of what we do. And I think historically, when we asked that question, 98, 99% of students said having campus health available to me helped me remain at the U of A. So I think we're a big part of the university's sort of story on retention. Obviously, everybody comes to the university with that goal of being successful, going through, getting that degree at the end of 4 or 5 years, whatever it might be. And I think we play an important role in that.
So, to ask a follow-up question on what Mark has just said, so how can students really best access those services on campus?
Yeah, we try to make it easy, you know, and I think one of the ways we do it is through urgent care, obviously on the medical side. But one of the things that, I've tried to do in my role, I kind of talked about keeping kind of our track record of excellence. I think the other side of that coin is how do we move forward in a way that continues to adapt to students today? So not students from 2015, but students for 2025 and students who are going to be here in 2030. Yeah. And how do we make sure that those services that we provide here are aligned with the students? Because the reason we exist is because of you guys, right?
Yeah, that's true.
So I think the other side of what I'm trying to do is, make sure that we have easy access and those services are lining up with current student needs are. One change, we made recently is really expanding the online appointments that are available, so students can book, get on your phone, make an appointment. It's very easy. Oftentimes, if we looked right now, we probably could find a same-day appointment. Those are available. That's true, I think, for the medical side, and obviously if students are struggling on the CAP side, students have the possibility where they can book something next week. We'll do that. But if students are in crisis, we want to see them right away, and we want to deliver, good care to them and get them connected to a counselor that they're comfortable with right away. So I think access is really, really important, and that's a big part of what we offer at Campus Health.
So over the years, your research really focused on programming and evaluation in the areas of alcohol and drugs. Was that kind of easy to find the data in the system?
Yeah. That's some of my work that I've done, certainly. Yeah. And, it's kind of interesting because, historically there's always been a lot of interest in alcohol and other drugs with the college population. It's one of those things that can really derail students in terms of substance use and abuse. So we've always been keenly aware of that. And I think, programming has always been really tailored to that. So students being away from home for the first time, there's a lot of risk potentially with that, and we've tried to seek that out in a lot of different ways. So I'm really proud of the fact that as an integrated model in terms of, and when I say integrated, I mean we've got medical services, counseling services, public health, health promotion all under one roof. It's pretty unusual in the broader, kind of healthcare landscape. One of the things that we're really proud of too is the fact that whether you're seeing a physician or a nurse practitioner, or you're seeing a counselor or a psychologist, or you happen to be talking to a health educator that came to one of your classes, all of those individuals are really well versed to talk to you about substance use on your terms, and we do a lot of that. So we will do some screening through a health history form. Yeah. So that can happen. That education can happen on a variety of different levels with a lot of across different disciplines at Campus Health, and we actually have a interdisciplinary team that works collaboratively in terms of supporting students around alcohol and other drug prevention. One thing I will note, because I think oftentimes when people hear college students substance use, people think, well, it's the way it always has been, right? One of the interesting things you point out on the kind of assessment and evaluation side is that we've seen over time, and this is true at a national level, but it's also really clear from our data that we collect here at the U of A, is that we've seen significant declines in substance use over time. Now, some things change. I know Zins are very popular right now, so we're seeing more of that on the nicotine side. But in terms of alcohol use, a lot of those numbers are at historic lows since we've collected survey data going back to the 90s. So a lot of these things have really changed, and we see that nationally. And the fact that that kind of triangulates with our data here, I think reinforces some of the trends that we're seeing. But again, as I mentioned before, tailoring the programming to student needs, we're always going to need programming on substance use and support networks for that. We also have a Wildcats Anonymous AA group on campus, which is just a wonderful group of students who meet on a regular basis at Campus Health. But we've got a variety of different programs that support students. But even as we've seen declines in some of these areas, obviously we see increases in other things, things like mental health, kind of things going the wrong way with that. Obviously, we talked about social health, things like loneliness, students just need a little bit more support finding their way at the university. So that's something we're really attuned to.
I know you've talked about some of the challenges and looking at the evaluation that you do every year concerning the students' health. So what are some of the challenges that you see mostly when it comes to stress, alcohol use, or other health issues? And I know you've kind of touched based on some of them. So what are some of the biggest challenges that we have here with students that because I know when you take the survey, you kind of have the highest number and okay, the students are suffering from this and I think this will lead to this. So have you seen such in the survey?
No, that's a great question. And, it's something that, we continue, the data is only useful in terms of what we do with it, right? It's interesting to see the trends, but I think what we really have tried to do is, we're always going to have programs focusing on alcohol and other drug prevention because, it's a common pitfall. Even though things are moving in the right direction, it's still affecting students, and we want to acknowledge that. But we also know that, as I pointed out, I think the sense of not feeling connected or social isolation or loneliness, that's, we've all read there's more likelihood of that right now.
Yeah.
I'm actually really impressed with a lot of our students because now these are a lot of the students who had maybe a little bit more of a normal high school experience. And I think students are also coming out of the pandemic. You guys had those during kind of your formative years, but I think more students, because of the pandemic, are also keenly aware that your social health is really important, and that's a big part of the university experience. And I really see a lot of students, prioritizing that, and I think that's going to trend in the right direction, hopefully. But we definitely want to have programs to support that. I'll give you one example. We started a program called Highland Hangouts. I'll plug it here on the podcast. Hopefully some students check it out. But it's every Tuesday from 5 to 7 in the Highland Bowl. So just north of Campus Health, we've got that beautiful green space. It's usually shaded in the late afternoon, and now it's getting cooler in the late afternoon and early evening. But there's always going to be some type of food, lawn games, spike ball. You can come cornhole, throw around the football. No big agenda in terms of as an event, or it's not really outreach for us, but it's just an opportunity for us to hopefully promote students coming out and just being social, meeting some people, and having a good time. So that's one of the examples that we're trying to work on through both Campus Health and throughout Student Affairs.
I was interested on what inspired you to go into the studies of alcohol and drugs for students.
Yeah, I think that was a big area of emphasis as I was, coming in at Campus Health and started as, a professional here. And, it always kind of interests me. I always kind of had, an interest in that because I think it, it's often the tip of the iceberg, right? Students, if they're using alcohol or other drugs, it's often, there's something else, there's some antecedent cause. And, sometimes it's, trying to fit in. Sometimes it's, a not great way to cope with stress. But I just was interested in kind of how it intersected with other elements of, social and mental health. And, it was a big area of emphasis, definitely when I started at Campus Health. We had a lot of, grant support that funded a lot of the activities that we did. We actually, for a while, we had a column in the Daily Wildcat called the Red Cup Q&A, and students would write in questions about alcohol, and we would debunk myths. This is kind of a different format, right? And I think this is cool that you guys are doing the podcast because I think obviously this is the direction things have been going in recent years. But, we used to do a lot of writing on this topic, and we'd get a lot of questions from students about it. So it was definitely something they were interested in, hopefully. I'd go help out with some classes on the public health side as well, and with that covered drugs in society, and always had an interest in that. I actually taught some of the diversion classes that we had at the university. So, it's, whether or not, people want to hear it, I think it's a topic that everybody's got some level of interest in. So I think that made it fun for me.
You talked about being a professor. How was that like for you?
Yeah, well, I'm not a professor by any stretch of the imagination, but I do kind of help out on the academic side. And actually a lot of us do at Campus Health, which we're really proud of, whether it's, working with students who are, training to be health professionals, nurses. We've got a new psychology program. We work with a bunch of students from the psychiatry program as well. So we do a lot of that. I'm really proud of it. Actually, earlier today, I was over at the College of Medicine I serve as one of many facilitators who help out with one of their bachelor's in medicine program, and they kind of a public health facilitation track. So I really enjoy being part.
I think it's amazing when professors or any faculty at the university get involved with the students and talk to them and have a conversation. I think that's one of the most important things adults should do at the U of A. So our next question is, if you could give students 3 simple wellness tips to thrive during their semester at the U of A, what would it be?
Yeah, that's a great question. I think it just maybe a couple of things we've talked about, and one other thing that I'll just start with. I think number one, and maybe this gets, I don't know, sometimes it gets omitted, but I would say work hard. I think that's really important. I think having a good work ethic while you're at the university is really important. When you're working hard, you're going to fully engage in the academic experience. And, whether it's, getting a lot out of the class, content, or, getting to know your professors, being curious and being fully engaged, working hard. I think that's a big number one. And I think, too often we don't think about that in health. Oftentimes we're focused on, kind of maybe more setting boundaries or doing less. But I think being fully engaged in what you're passionate about is really important, because that's sort of the why, right? That's what gets us up every morning and makes us feeling inspired about what we're doing, right? So find something that you like and pursue that. I think with enthusiasm, that's important. Number two, I think that the thing we talked about was, take the time to prioritize your social health, and make connections while you're at the university, whether that's, clubs and organizations, meeting people. That's a big part of what the university experience is. There's things that you learn in the classroom, and then there's the connections you make inside and outside the classroom. And I think that's got to be part of the formula. I think, that challenges us. We're richer because of it. We make connections and friendships because of that. And I think that's really special. And the third one is probably just more of a standard one you've heard before, but I think it bears repeating, is really prioritize sleep. I think sleep is so important. It's probably one of the hardest things for college students to prioritize. And you guys laugh, right? Because I think everybody's in the same boat trying to get enough sleep. But I really think it's important. And, it's obviously striking the balance. How do I work hard, have a good social life and sleep? But I think, if you make time for those 3 things, it's really important. And sleep, we've done some research on sleep at the university and at Campus Health, and I just think it's great for our mental health. It's the thing that renews us every day, and it's sort of the wellspring of our energy that we really, I don't discount it. It's important. I think the biggest thing for students is just, making time for it, trying to get that, 7 to 9 hours, and keeping it consistent. Going to bed, wake up schedule. That can be really hard for students. I acknowledge it, but I think the students who do it, it's hard to go back to doing something different, because it is pretty life changing in terms of, you're better at everything you do during the waking hours if you're getting enough sleep. So that's a big one.
I remember, so I'm taking one of the honors classes, and the first day of class, we were asked some questions, and so the teacher was like, how many hours do you guys sleep? And so some had to say like they sleep for 8 hours, and if they don't sleep for 8 hours, then they won't function. And everybody in class was just laughing about it, because that's not true for college students. And the other student said for him, he only slept 2 hours. He's in class, he's doing well, he feels better, and nothing's going to happen to him. But I remember like one time I was having a conversation with my mom, because he always tells us the same thing, guys, you must have enough sleep. And we keep on telling her, because we have all these schedules and classes and everything. But she's like, you don't see it right now, but you'll see it 10 years from now in the future. That's when you kind of like realize that, sleep was really important, because that's when you start to see the effects. But when you're still younger, and because you're part of the environment where everybody sleeps for 2 hours, 4 hours, you're like, we are all the same and we are all doing well. So what's the point? But you kind of have, like you said, you have to prioritize your health, because that's important. Much as you have a good career ahead of you, you have money and everything, and if you have complications with your health, then you won't be able to attain all that.
it's the best free thing you can do for your health every day. Obviously, if you gave me a fourth option, I'd say, staying physically active, getting outside, those types of things. But I think sleep is such a big one. So many aspects of our health funnel through sleep. And it's critically important. I mean, I think another way to look at it is, if you ever, if you follow sports at all, and you hear about professional athletes talking about their sleep schedule, they sleep a lot, right? Because we know, in terms of muscle recovery and all the energy expenditure that they have during games, they recover a lot. They actually need a lot of sleep. But I think college students are not that different from, professional athletes. I mean, you guys have a lot on your plate. You're managing, work, school, internships, social life, family, all those other things. So, everybody needs it. So I think it's, not everybody needs 8 hours, but, most people need, at least 7.
Yeah.
And, I think, there's always going to be exceptions, right? There's, times when you're going to celebrate and stay up a little bit later, and that's all right, but I think it's what the rule is, not what the exception is. And I think that the more you can kind of be consistent with that, people tend to feel good about it.
With the rise of AI use, how is the campus health dealing or managing students who use it to self-diagnose?
Oh, that's a great question. Yeah.
Maybe even use it to explain their symptoms. How is campus health overcoming that?
Yeah.
Or at least correcting?
This is a great question. I think AI is, getting into everything, and, certainly in healthcare is one of the big things. I think it actually has the potential to do a lot of positive things. I think we're actually in the process of looking into, in terms of medical transcription AI, is there a way that we can do it securely, safely, which can actually, help notate things for the physician, help construct a SOAP note as a provider, and allow providers to actually spend more face-to-face time, so you're not on the computer kind of going back and forth. So I think there are some positives. I think oftentimes we look at the negatives, and certainly there are some of those, but I think we got to be really careful about how we use it, and be mindful of the risks. But yeah, you're right. I know students are using it, right? Because it is an amazing tool, right? I think, we've heard stories about, people who have used it as kind of a therapist as well. And I think there's a lot of questions and concerns about that. And I think the deeper they get in these models, the more things get muddled.
Yeah.
And, that potentially can, get into some risky territory. So we're definitely mindful of that. And another reason why we want to be accessible for students, because we know there are these other immediate free options, but we want to make the services that we have at Campus Health really, really accessible. So they'll consider us.
Are there some new initiatives or resources here at the UVA that you're most excited about that will empower students in some few years to come?
Yeah, I think one of the things we made kind of permanent last year was, we through our counseling and psych services unit, through CAPS, we actually made all the groups free. Groups are kind of interesting because it's one of the things that students are often reluctant, not just students, any patient, anybody is less reluctant to seek out group therapy. People want to have an individual therapist, right?
Yeah.
But actually a lot of research shows that group therapy can be as, if not more effective than individual therapy. The challenge is getting people to that first group visit. So I think we're focused on that. We've also done some affinity groups. We've noticed, especially with guys, group therapy can seem a little more intimidating, but we've kind of thought about like tabletop gaming and other types of things we can do to draw people in who might not otherwise show up to a session. So trying to be creative with that. Another example I can give you on the CAP side, which is a little different, we actually have a new UA crisis mobile team. So we have a very small team that actually goes out following a 911 call once it's kind of cleared by UAPD. So oftentimes a lot of those emergency responses have a mental health component, and we want to acknowledge that a law enforcement is a really important piece of that, but it's not the only piece of it. And we also, and UAPD has been a great partner with us in terms of inviting us in and letting our counselors be kind of first responders on the scene to talk through issues. And that's been very helpful. Oftentimes, someone's in crisis and they need somebody to talk to. And that's the right fit for them in that moment. So that's been really great.
Well, thank you so much. This has come to the end of our episode today. It was really nice talking to you about campus health and what you do. We see that you do a lot of amazing things that students need to check out because they are missing out a lot of information. And we also appreciate your time for just coming out to speak with us. We know how busy you are working on different projects, but you took that time to speak with us. I don't know if you have anything else that you want to share with the audience.
Thanks for having me on, and hopefully this is helpful. And hopefully, I think just the biggest thing is, if students ever have a concern or need help, they can always reach out to us on the medical side, on the CAP side. We also do a lot of outreach, as I mentioned, through health promotion. So if you ever want campus health staff member to come to your club or organization or deliver a talk, we do a lot of outreach that way. And check out the website. We have a calendar with ongoing events if students are interested in that, and a lot of ways for students to get involved as well, which we're really, really happy about. So thanks again for having me, and I'll let my daughter know I was on a podcast. So that's very cool.
Yeah, thank you so much.